Steve's been kind enough to join us tonight and is a fabulous nurse that works on the neurosurgery and orthopedic floor, and he has some involvement with the postsurgical aftercare home health program. Tell us a little bit about what you like about working on the floor.
I think working on the floor for me is I'm able to be one-on-one with the patients. I'm able to help them throughout their hospital stay, and hopefully, if I do my part, prepare them to go home, so that they can be a little bit more prepared. They can go home and heal. I've been there for 7 years, so I must like it enough to stay, and I do. And it just the vast kind of variety of cases as well, anything from brain surgery all the way to, just our simple cervical discectomy or fusion, and I just like being with the patients and being at their bedside and really spending that time to educate and get to know them.
How have you liked the home health / post-surgical aftercare involvement? What has that been like for you?
To be honest, when I started home health and doing the post-surgical aftercare, it made me a better nurse in the hospital because I had a perspective. I knew what these patients were going through, and I knew what they were going to go through at home. And so by knowing that, I was able to go to the hospital, I was able to nurse differently with a long-term perspective, knowing that when they go home, then I can also go and see them at home and help them heal, help them get off of pain medications, take an active part in their healing process, get to know them better. I mean, it's nice to be able to sit in a chair face-to-face, one-on-one with your patient and just talk and educate and get to know them on a little deeper level than I can in the hospital. Home health is a really awesome experience.
Do you feel like the patients benefit from a post-surgical aftercare program?
Definitely. Having worked with many different doctors throughout my time at Utah Valley Hospital, I feel like those that go home with home health on a post-surgical aftercare program do better. We see less readmits. We're able to catch infections. We're able to teach the patients how to take an active part in their healing. We're able to re-educate them. And I think that's one of the biggest pieces. In the hospital, they get so much thrown at them. And they don't know sometimes it goes in one ear and out the other, and they don't know, when they get home, they're like, oh, I should have thought of asking the doctor that. Well, they have a nurse that comes in, they have a physical therapist that comes in, sometimes they have occupational and speech come in, and we're able to answer those questions at their bedside in their home. We're able to teach them how to do the dishes properly with good posture, how to do their activities of daily living. We're able to sit down and go into detail about their medications and how it can help them and how we can get them off of their narcotics so that they're not building up a tolerance. It's just, there's so many things we can do in the home to help patients heal. And for those who aren't receiving it, I feel bad for them in the hospital, knowing that they're not going to go home with a home health program.
From my perspective, we rely heavily on excellent nursing care from nurses such as Steve to help take care of the patients after surgery in the hospital and also at home. The patients that decide not to do post-surgical aftercare are more commonly the ones calling the office with issues. So I know that many issues are prevented or picked up on with you and others that really help. So we're very appreciative of all the work that you do, and I think that the patients that come through the practice that have surgery, we feel very confident that when they go to the floor, when they go to the ICU, and also when they go discharge and go home, they're in very good hands. And if there's an issue, we are alerted to it. It tends to get taken care of, And we have very few significant problems, in large part because of excellent nursing care. So thanks for all that you do.
Problem.